Assalamu alaikum, and my best wishes to all the students and everybody who will be watching this video. So, in this video, I'll be talking about obesity and physical inactivity. The learning objectives for my session would be that by the end of this session, those who are watching this video and my students, they should be able to describe risk factors for obesity, talk about them, describe assessment and consequence of obesity, and then describe preventive strategies for physical activity and obesity. So, moving on, what is obesity basically? Obesity refers to a nutritional disorder which is due to imbalance between energy intake and energy expenditure, resulting in positive energy balance. Therefore, person takes too much of energy and then ultimately it ends up in positive energy balance and person puts on weight and becomes overweight and becomes obese. Now, this condition is characterized by abnormal growth of the adipose tissue, resulting in an increase in the body weight to the extent of 20% or more. If your body weight is 20% or more for your age, for your gender, for your height, you are called obese. Okay? Now, what is the magnitude of this problem? How common this problem is? That we know this problem is increasing worldwide at an alarming rate, affecting both adults as well as children. And therefore, we need to do something as quick as soon as possible. And it has been seen that this problem is more common in urban populations because of the changing lifestyle. Because in rural population, people are more or less still active because of their engagements in agricultural work, whereas in city, people are becoming more and more sedentary because of the life has become more mechanized. Now in India, the estimates say that 8% of population is, at this point in time is obese. If you take BMI of 25 as cutoff, if you take lesser than that, then the higher percentage would obviously go up. Now, as far as the public health importance of this condition is concerned, there's no doubt about that. It's a very serious problem that we need to tackle as soon as possible. So, as we know, the obesity is a risk factor for the natural history of a number of diseases, especially chronic diseases like ischemic heart disease, diabetes, hypertension, stroke, and others, and some of the cancers also. And therefore, it's very rightly said that obesity is called a king of diseases. And obviously, if you take care of obesity, you'll be taking care of many of these conditions that are likely to ensue following the occurrence of obesity. Now, what causes obesity? Very simple. You can easily explain this, understand. And two in terms of risk factors, we have non-modifiable risk factors and modifiable risk factors. Among the non-modifiable risk factors, age, as we know, usually people tend to put on weight beyond their middle age, and more so in females than in males. And some people can be obese right from age, right from the beginning, also in childhood. And we know that if somebody is obese right from childhood, it's very difficult to control the tendency later in life. Then, as far as gender is concerned, obesity is more common in females. They say that males tend to be more overweight, whereas females tend to be obese. And genetic factors are the other is in families. Usually, the parents are obese, and children tend to be obese. And children obviously start this obesity very early in life, very difficult to control these conditions. And then we have non-mod factors on the physical activity, reduced activity, which is nowadays seeing it around us, which is contributing to obesity. Then socioeconomic status, they say if you're purchasing power and you tend to eat more costly and more heavy foods which are heavily laden with saturated fats. Then literacy level, obviously it has been seen that once literacy goes up, obesity tends to become less common. And body image, previously it was observed that if you are obese, you would sign of prosperity. But now this has changed. The obese person usually has a negative body image. People tend to reduce body weight to look better, look more attractive. And eating habits, the habit of taking too much of fats and oils and fried things, those things are controlled. And then lately, the advent of fast foods ultimately the occurrence of obesity. Then alcoholism. Alcohol is said to promote obesity not by direct providing energy because alcohol usually cannot be metabolized, stored as such, but it burns immediately. But then the energy coming from other foods gets stored. That's how alcohol contributes to body weight, increasing body weight and obesity. Smoking is usually tend to have a negative relationship with obesity. Smoke more, just might be put on weight. But obviously, smoking as such is a bad habit, having being effect for other conditions. We cannot promote smoking as a control measure for obesity. And psychological factors like stress and anxiety are promoting it because people who are distressed tend to eat more. And drugs like steroids and contraceptives. The environment factors like availability of mechanization now, the transport, people tend to walk less. They have washing machines, they have vacuum cleaners, they have escalators, elevators are there, which reduces physical effort and therefore promoting obesity. So obesity is becoming very common, a very common scene to see. It's very unfortunate. Now, as far as the measuring obesity is concerned, primarily number of indicators are there. Primarily, four of the indicators are commonly used. One is the what we call as the corpulence index. This is actually the ratio between the actual body weight and your expected body weight. And if ratio is more than 1.2, you are obese. Now, this expected body weight obviously can be calculated by a number of ways. Like one of them is what's called the Broca's formula. You take your height in centimeters and then subtract by 100. That should give you the expected body weight. Say, for example, your height is 150 and if you subtract by 100 means 50. The answer, therefore, your body weight should be 50. So your expected body weight is 50 kgs. Then BMI usually is a population measure of the overall nutrition population, especially looking at obesity in the population. And it's again a ratio measured by taking a ratio of weight in kgs and then height in meters square. The recommended for the Southeast population is the ratio between this range of BMI between 18.5 to 22.9 instead of 24.9 because Asians have been found to have developed these factors much earlier with lower BMI. Therefore, it's recommended really opt for lower BMI. Then waist circumference, as we know, it's measured between the midpoint between the lower border of the rib cage and the iliac crest, and a measure of more than 102 centimeters in males and more than 88 centimeters is taken as a sign of the abdominal obesity or fat accumulation, which is a risk factor for ischemic heart disease, especially. The waist to ratio between waist circumference, hip circumference, and it's usually taken if it's more than one man and more than 0.85 women to indicate fat accumulation. Now, these are some of the measures which are used to express obesity: corpulence index, body mass index, waist circumference, and waist hip ratio. And among them, obviously, waist hip ratio and waist circumference are very sensitive compared to body mass index, which sometimes can be, especially in people who are tending to have less fat or more muscular, can be misleading. Now, as far as hazards of obesity are concerned, this can be expressed in terms of relative risk of developing some of the problems if you have obesity. Now, in this category, we have certain conditions which are greatly increased. That means these conditions have a relative risk of more than three with respect to with obesity, like diabetes, gallbladder disease, dyslipidemia, insulin resistance, and others. And then there are some conditions which are less likely if you have obesity, like cancer, which are usually slightly increased, or impaired fertility. Whereas some conditions are moderately increased. That means risk ratio is between 2 and 3. That means having coronary heart disease, hypertension, osteoarthritis, or gout, you have a chance. But the first category obviously is a serious category which can increase if you have obesity, more likely to have these conditions. So it's better to avoid obesity to end up in some of these conditions. And as far as prevention control of this condition is concerned, the prevention obviously is very important. It has to start very early in childhood because once developed, it's very difficult to control body weight. So it really becomes something called irreversible. And then the consequences which can result from obesity, like ischemic heart disease, hypertension, stroke, and other problems, really are really irreversible. Even if you reduce the weight, you may not be able to reverse some of the conditions and get back to the normal. So it's better to prevent obesity rather than treat obesity. Then, if you're looking at the control obesity, what should be the aim? So obviously, the best thing would be to do to help people maintain a BMI, which is ideal, 18.5 to 22.9 throughout their adulthood, prevent development of overweight, prevent progression from overweight to obesity. Then, obviously, for those who have already lost weight, prevent them from gaining weight again. Therefore, the particular that stage of life, the lifestyle has to maintain, which helps them maintain a lower body weight or ideal body weight. Then, look at the strategy that we have at our disposal as far as control of diabetes is concerned. The best is the first thing that has to be done is the education. People have to be educated about the hazards of obesity, what obesity can do. Then we need to prevent obesity by healthy diet and lifestyle, which have to be promoted very early in life. That means we resort to what's called as primordial prevention, followed by primary prevention. The primarily focus in this condition has to be on primordial prevention. Then the second thing that we should focus on is the dietary changes. Putting it simply, what we need to do is that we need to refrain from overconsumption of fats and carbohydrates. So in fats, primarily it is saturated fats, and for carbohydrates, it's the refined carbohydrates that we should refrain from using because they are the ones which promote overweight and obesity and other problems arising out of that. And therefore, the diet should contain suitable proportion of cereals, legumes, and vegetables. Therefore, what we call as a balanced diet has to be promoted. And we don't need to keep in mind the diet at the end of the day. What we do is that our energy intake should not be catered with our energy expenditure. Because if it is so, our body will end up in a positive energy balance and therefore there will be rising body weight and then obesity and then other complications. Then we may have an option of having some surgery in patients where the minimum is very high and it's difficult to control other routine measures, and we may resort to this. But this kind of treatment is only possible recommended for very, very small minuscule population, and it is not easily available in most of the centers. Therefore, it's not an option. Better options are the first ones, and the one that we are going to discuss now is the physical activity. It's a very important one. As has been seen globally, WHO reports that physical inactivity accounts for one-fifth of skin heart disease and one-tenth of strokes and breast cancer, and one-sixth of colon cancer. Now, physically inactive lifestyle accounts for 3% of all deaths. So, a lot of deaths occur because of the inactive lifestyle, overweight, and obesity, and then conditions, as we discussed, those chronic conditions which can lead to death and poor quality of life. Now, physical activity, which is the counterpart, opposite of physical inactivity, has a lot of benefits. It's not only the weight that you control, it leads to what we call as physical fitness. That means if you engage in physical activity, it will help you keep your body weight in check. It will help you improve your insulin sensitivity, for helping you control and prevent diabetes. It will it mobilizes preferentially visceral fat, reduces dyslipidemias, ischemic heart disease, and diabetes. Those who are engaging in physical activity are less likely to have these problems. Then improves lipid profile. It has been seen that people who are engaged in physical activity tend to have high levels of HDL and lower levels of LDL, cholesterol, and triglycerides. It reduces post-systolic blood pressure, improves your blood pressure control, improves cardiovascular function otherwise. Because on exercise, usually there is the better toning of the muscle of the heart, and there is something called the opening of collateral vessels in the muscle of the heart, which improves its suction, utilization, stroke output, and other parameters of heart function improve. That means your cardiac reserve increases. It reduces anxiety and stress. So physical activity has been seen to lead to a sense of well-being. It improves bone density. So physical activity improves bone density and therefore reduce the chance of getting problems like osteoporosis. Then physical activity has been found to protect against a number of cancers, especially like colon cancer. Now we can see that physical activity has many other benefits rather than just controlling body weight. So therefore, when you engage in physical activity, we should be focusing on many other parameters, other advantages and benefits that can derive from physical activity, not only controlling our body weight. Then it's a very important thing that once you advise physical activity to the community, what exactly should you tell them? So there has to be something we call an exercise program what they should engage in. The most important part, obviously, this is the endurance exercise. That means they need to engage in exercise, which is what's called as aerobic physical exercise, using a high proportion of maximal oxygen capacity. So we need to engage in exercise which really puts the body under stress, not only just having a simple walk would help. Okay. Now in this case, how frequently should we exercise? Once, ideally it should be 4 to 5 sessions a week. Minimum they say it's 3 sessions a week. That means every alternate day you should engage in some kind of physical activity. Then as far as intensity is concerned, the recommended is the moderate intensity exercise. Now to measure the intensity, we have a number of ways of doing this. One of the ways is we call as maximal permissible heart rate. That means you subtract your age from 220 to 0. That gives you the maximum heart rate that you can achieve during the exercise that should try to achieve. So, for example, your age is, say, you are 50 years of age, and you subtract this from 120. 220 will be 170. That means 170 is the heart rate. If you try to, the maximum that you try to achieve during your exercise. Not that easy. And they say that if you achieve 50% of this, means you're supposed to achieve 170 and you have achieved 85. That means it's very low intensity exercise. And therefore, target has to be around 70 80%. That means you should focus in around 130, 140 heart rate. That will be your engaging in moderate intensity exercise. Beyond that, obviously, you'll be vigorous, very vigorous. And second one is the Borg scale. We have a scale from 0 to 20. Once the person engages in exercise, and you ask him to do, on the scale, give us how much. And usually they say that no, we should start with a scale of 12, and then ideally should focus around 16 and plus on this scale, which usually comes to around that moderate intensity exercise, which will be helpful and which will actually give us the benefits of physical activity. The third is something using a metabolic equivalent. Metabolic equivalent basically is in terms of energy consumption. Usually, our body consumes around 1 kilocalorie per kg per hour. You rest when you are doing nothing. That's called as 1 MET. 1 MET is 1 kilocalorie per kg per hour. And the recommended level that MET should be around 5, 4.5 to 5. That means usually you should engage in some kind of moderate intensity exercise. You should raise this MET level, that level. That's what we should be focusing on when you are exercising. That means you have to engage in moderate or a vigorous intensity exercise. Then the important thing about this program is the duration. For how long? They say it should be around 150 minutes of moderate intensity exercise per week. That means 30 minutes per day for a period of 5 days per week would be sufficient. Or if it's 45 minutes, then you can repeat the number of days. Or it should be minimum 50 minutes. It can be more. Then there should be 75 minutes of vigorous intensity also. That means in this case, you have to engage some activity which increase your heart rate to beyond 140. That means moderate intensity would be in terms of a brisk walk, while its vigorous intensity would be in terms of jogging or cycling or swimming, something, some kind of activity has to be done. Then they also recommend some muscle strengthening exercise also. It should be done 2 3 times a week, which will be in terms of push-ups or squats or weight training if you have access to the gym. But otherwise, for normal people, you can recommend just having a few push-ups and squats would help us. Then importantly is the flexibility exercise, right? Gentle stretching of the muscles. They will recommend that we should stretch our muscles, some major muscle groups, 5 minutes before and after you engage in an exercise session. So this is how this exercise usually has to be advised. You tell them about frequency, about intensity, about duration, and muscle strength exercise and flexibility. But primarily the first three are very important, especially the intensity part. If you be told how intense the exercise has to be. People engage in activity, but they just walk. Simple walking is a very low intensity exercise, which really will not give much benefits. Okay, now let's summarize what we discussed in this was we talk about obesity, what obesity is, how what are the issues that result from obesity. We talk about the how obesity is measured, we talk about those four measures. Then we discuss the consequence of obesity and physical activity and what are the factors why physical obesity is becoming very common now. And then we discussed what can be done in terms of health education, in terms of diet, and changing lifestyle, especially the physical activity part. We talked about the benefits of physical activity. Then we talked about how physical activity actually has to be advised to the community, what they should exactly do in terms of its, frequency, the intensity, the duration, and other things which are physical activity. Thank you very much.